So does everybody, just a show of hands, does everybody in this room know what screening activity report means? Yeah, okay, let me rephrase that. Who doesn't know what a screening activity report is? Good. Okay, thanks. A screening activity report is a tool that Cancer Care Ontario has developed, starting with the Colon Cancer Check program back in 2009. And it was a paper-based report back then that was available for all physicians in a patient enrollment model to be able to track their rostered patients in terms of their screening activity. And it's moved on from being just for colon cancer check to breast and cervical screening as well, so that you can track your patients. But it's now online, and you need to have the one ID in order to access that. Okay. Yes, I meant to say this earlier, that this conference has been generously supported by the Waterloo-Wellington Regional Cancer Program, as well as the Southwest Regional Cancer Program. And I don't have any conflicting interests. So what's new? The target audience, primary care physicians in a patient enrollment model. And what's new is, and they're delegates. So over the last couple of years, we have made it possible for, after listening to busy physicians over and over again, that this is a report that when it got more complex and more complicated, when we added 2 more disease sites to it, it was just becoming quite overwhelming. So it is possible to have a delegate within your clinic, and even if you're a solo practitioner, if you want to put your receptionist or if you have a nurse in charge of looking at this and keeping up to date with it, you can do that, and you can do that actually online. If you ever need any help, go see the lady at the back there who will help you at the Patient One ID registration booth. The report purpose is it's a supplementary tool for improving breast, cervical, and colorectal cancer screening rates. And what's new is that it used to be every 6 months, and it's now monthly. And it's actually, you'll get an email if you are registered with One ID saying the updates are ready. I believe it's around the 10th of the month, but so that you know the new data is there. And hopefully it's going to be, as we do these updates quicker and quicker, that's going to match more with what you see in your EMR. So what does it give you? Breast, cervical, and colorectal screening participation rates, and that's per physician. You'll see this on your dashboard, per physician, LIN, and province, and that's been the case all along. The patient population size for each of the programs, the numbers of patients that are eligible for screening, who's excluded due to previous surgery or program-specific cancer, who requires follow-up, who's due for screening in the next 6 months, and who's up to date with screening. So it's a lot of good, rich information for you, especially if you've got patients that have come to you from elsewhere and they don't remember when they last had a screening test done. If it was done within the province of Ontario, you'll be able to pull this from the screening activity report. So it gives you a detailed screening-related history, as I mentioned, the date and result of last screen, date of the most recent abnormal screen, any history of exclusionary criteria, and the date of follow-up activity. And it's now interactive, so you can just click on anything that's underlined in the report, and it's in a hyperlink which will take you to give you a list of who the patients are that are due for screening, making it a whole lot easier, and who's overdue, and what needs to happen next with that patient. So this is a dashboard. This is what you'll see first when you log on to your screening activity report. You can navigate, as I said, to the population of interest by selecting any of the hyperlink numbers, and this has proven to be much more useful. You can, I don't know whether you can see, anything that's underlined, click on it, and that's a hyperlink to take you to a list of who those patients are. So this is really the meat and potatoes here, and this will all be in your package that we will email you, that we will have available on our website, and we'll email you and let you know when it's ready, so that if you open this up, you can find on the SAR website access to frequently asked questions, and information about the data in the SAR. You know, I hate saying SAR because it brings back too many memories, but you know, there you have it. There's a series of instructional videos which are incredibly useful to remind yourself of how to do this that are available on the SAR website. How to navigate, there's one on that. There's one on how to find patients who require follow-up of an abnormal test or who are overdue for screening, how to export to a PDF or Excel file, and how to go about appointing a delegate. And there's also a nice little video that one of my colleagues in the York region did, Dr. Marla Ash, which discusses the benefits of the SAR for a family health team, and again, another YouTube video. We get, as regional provider leads, we have access to regional level data, and we've actually been asked for this because there's a number of practices, family health teams that are large who have quality improvement specialists working with them. If they could have a report about screening activity within their group. And we can do that. We need permission if it's going to be, if it's not going to be anonymized. Each individual physician in that group would have to give permission for the data, but it's been used to help planning for outreach for high and low performing physician groups, and also within each family health team if they want to try and help and find out what's going on, what's going right, what's not going right.